Hello, everyone. Not sure about the quality here, but I'm going to do a little run through of a conversation about slow medicine in pandemic times. Slow medicine is an idea that came to us by language two ways. One, when we say slow medicine, we often are referring to the slow food movement that started in Italy. And Italy, being such a gourmet country with a whole Mediterranean diet, healthy outlook on food, thought that fast food was getting way too fast and it would be better to slow things down. Well, same thing's true about medicine. Some of us have realized that medicine is way too fast. People do not understand what's being said to them. They don't have time with their care providers, and that needs to change. I think it's fascinating that Italy, in the pandemic, found a way to give each other heart with all the beautiful singing that we saw at the very beginning of this miserable year. As I record this, we're coming up on exactly a year, March 13th, from when the President of the United States of America back then announced that we were in trouble. I decided that it would be really lovely for us to review what that means. It means many things to many people, but I'm thinking specifically of what it means to people 55 years and older. In the United States of America, we consider 75 old age, and we consider 85 very old age. That means, in the language of geriatrics and doctors, that's our definition. When I was a practicing physician, one of the things I always wanted to do is check in with my people on their relationships. So one of the first questions I used to ask was, okay, let's say you were smitten with the flu. Who's going to come and take care of you? So I asked my audience for this. Who are your supports? And when I was thinking flu back 20 years ago, I wasn't thinking at all about something like COVID. But many times, busy people would, in my office, break down in tears because we are a very isolated culture. And we were isolated before all of this happened. So our over 55 community here in Central Vermont has had a wonderful resource called the Montpelier Senior Activities Center. And I'm looking at what happened there as far as care. And the community has been continuing a meal program. I think that's a wonderful thing. Do you have relationships with a healer that you can trust? The pandemic has made all of our primary care people, except people like me who are retired and told them, here's what I'm good for, I don't think you want me, on high alert and distracted and stressed. So if you come in with what might feel like a big problem to you, where do they rank it on their radar because of the background noise? With that in mind, what do you do with respect to insurance or non-insurance? Do you use, like too many people do, Google Doc for diagnosing yourself? How do we assure that we get quality services? So one thing I suggest people do is remember that psychologically and emotionally being ill is a stress on us, and most of us would revert to emotional state of about a 6-year-old kid when we're seriously ill. So don't go anywhere by yourself. Take a buddy. If you have to go somewhere alone and you're trying to listen to people explain themselves to you, medical ease wise, you might want to have a tape recorder with you. That's certainly better than nothing. Whoever you are out there, I suggest that you take a look at this. It's called 5 Wishes. It's available over the internet, and it used to be a program put out by the Death with Dignity people, but they changed their name to Aging with Dignity. We are a very death-phobic culture, and it gives you a worksheet, a work list of what you can do to let people know how you want to be treated when you are sick. Even if you are conscious and can still communicate this, it's really nice to have details. The person I want to make decisions for me when I can't, the kind of medical treatment I want or do not want, how comfortable I want to be, how I want people to treat me, what I want my loved ones to know. And this is prepared for somebody who has a terminal diagnosis, but it's amazingly useful for everyone. I did my own and made some decisions about how to help people understand when and why I would want to continue living and when and why I might not. I happen to be in a state that allows for euthanasia for certain terminal illnesses, and I think that is a good thing. So if you're interested in more, I will be doing talks on geriatric medicine, looking at the different systems and what we need to think about as we grow older, about orthopedics, about cardiovascular system, certainly our minds and neurology, our gastrointestinal systems, our urinary tract and incontinence issues, and our sexuality as a very, very important one that too many doctors don't ask about. And finally, cancer and death issues. So maybe I'll see some of you at some future program.